On today's show, we shall be discussing accidents in childhood. We have here on the show Dr Rachel Sutherland. Welcome, Dr Sutherland.
Hello.
We all know that children have accidents every minute of the day, but how common are accidents in childhood?
Well, to put it into perspective, each year in the United Kingdom, about 1 in 4 children will be taken to an accident and emergency department, and about roughly half of these children will be because of some sort of injury. Unfortunately, accidents still they are still the main cause of death in children between the ages of 1 and 15.
Gosh, yeah. And what sorts of accidents do children tend to have?
Well, of course, the list of possible accidents is endless. It sometimes depends on the age of the child. Serious and fatal accidents tend to occur in all age groups, usually road traffic accidents cause those, but also you can have things like fires, falls, suffocation, and rarely poisoning. Accidents very commonly occur in the home, and that does tend to be amongst the younger age group, partly because they're at home more often, and partly because they're big explorers, they run around everywhere, their little brains aren't catching up with their legs and the rest of their bodies, so that's why those things happen.
Let's just focus on accidents that occur in the home. What sort of injuries might a young child sustain in the home?
Well, as I was saying, little children exploring everything, they fall very easily. Obviously this can be serious if you don't have a stair gate or something like that. A child can fall downstairs, they can fall out of windows, they can fall out of their cots and have quite serious injuries. Fortunately, most of the injuries we see are children just tripping over and sustaining things like minor head injuries, sprains and small fractures.
What exactly is a head injury and how serious can they be?
Well, as the name implies, obviously a head injury is any injury to the head, but we mustn't forget that that includes the face as well. And we see a lot of facial injuries. Head injuries obviously can be fatal, and as I think we said before, the commonest cause of fatal head injury is still from a road traffic accident. Right. But also falls can cause serious head injuries.
What should parents actually look out for if they're worried about their child? Maybe their child has fallen down the stairs and banged their head. Are there any sort of signs or symptoms that we should be aware of as parents?
Well, a lot of children will fall in the home. I mean, a classic case is the toddler running around, falling over, banging their head on a coffee table. They usually scream for a couple of minutes, they get up again, and other than being miserable, a little bit off it, they're basically okay in themselves. What a lot of parents are very concerned about is because they'll have a big visible bruise on their head. So obviously one of the main symptoms is you can often see the damage that's been caused, whether it's a small bruise, a swelling on the head somewhere. Often we see huge egg-shaped bruises that parents are extremely concerned about, but the child is running around quite happily. And in those cases it's extremely rare that there's anything to worry about.
Right.
Having said that, obviously there are things that happen, and particularly if a child's had a significant fall, like you said, like a fall downstairs, some children, after they've banged their heads, will have a period of drowsiness or confusion. Some children vomit.
Right.
Other things to look out for, some slightly older children will complain of visual impairment or memory loss. And those things we worry about more. If you've got a child who's bumped their head and they've got any of those things, or they're drowsy, or just not well, that maybe you can't even put your finger on it, but they're just not right, then you need to really get help straight away. You need to go and get them checked out at your local hospital. Going on from that, of course, some children will have bump their heads and they'll actually lose consciousness.
Right.
And if you think that your child has lost consciousness in any way, this might just seem that they're a little bit stunned for a few minutes. They might be actually blacked out or,
Right.
or unresponsive, if that has happened for any length of time whatsoever, there is a slightly greater risk that the child has sustained a more serious head injury affecting the brain underneath,
Right.
and you need to take them to hospital to get checked out.
Right. If a child needs to go into hospital, what happens to the child while they're in hospital? Do they have to stay in to be observed, or do they have tests? What actually happens?
Well, obviously it depends again on the nature of the head injury. In every case, the child will be assessed by a nurse and by a doctor.
Right.
As I said before, in so many of these cases, you might have a nasty bump, or the child, quite a small child's had quite a nasty fall, but they're very well in themselves.
Sure.
In most cases, those children can be the parents can be reassured and send the children home.
Right.
If we have a few more concerns, as I described those symptoms, you know, obviously something like loss of consciousness, persistent vomiting, if we're worried about the children, then we may well do a skull x-ray, which is just looking to see if there's any skull fracture. And if you pick up a skull fracture, there's a quite significantly greater chance that there has been some sort of underlying bruising or damage to the brain and the delicate structures around it. Rarely a child requires a CT scan. If we're sufficiently concerned about the likelihood of brain damage, we'd do that. If in most cases children settle down and we're happy to discharge them home. If there's any chance, if we're worried about them in any way at all, we tend to bring them into hospital and observe them for a period of up to about 24 hours. And the vast majority have settled down by then, and we happily discharge them home.
That's very interesting and useful information, and maybe we'll come back to a few more interesting facts after the break. Let's hope you join us after the break to hear more about accidents involving children.